Hello everyone, this is Dr. Kathleen Estime, nurse practitioner. Today we are going to talk about fluid and electrolytes. Understanding fluid and electrolytes is a critical part of nursing school, and understanding a comprehensive approach to these essential concepts is what we're trying to do here. Here's a summary of key points you should know based on guidelines and common nursing school curricula regarding fluid and electrolytes. The first concept is total body water. You must understand that approximately 60 to 70% of an adult's body weight is water, distributed between intracellular ICF and extracellular fluids, ICF. ICF, about 2/3 of TBW, is found within the cell, and ECF remains 1/3, which includes interstitial fluid and plasma. In terms of electrolytes, you must understand the major electrolytes and their functions. The cations are positive. Those are sodium, potassium, calcium, and magnesium. The anions, which are the negatives, are chloride, bicarbonate, and phosphorus. In terms of fluid balance and regulation, homeostasis, fluid and electrolyte balance is maintained through renal function and hormonal regulation, including the roles of antidiuretic hormone, ADH, aldosterone, natriuretic peptides, and thirst mechanism. Understand the physiological trigger for hydration needs. In terms of electrolyte imbalances, common imbalances are hyponatremia, low sodium, and the symptoms include confusion and seizure. Hypernatremia, which is high sodium, symptoms include thirst and confusion. Hypokalemia, which is low potassium, which is symptoms include muscle weakness. Hyperkalemia, which is high potassium, with symptoms include palpitations and muscle fatigue. Hypocalcemia and hypercalcemia, know the signs and symptoms and management strategies. In terms of clinical manifestations, be familiar with how each electrolyte imbalance presents in patients, including pertinent lab values. In terms of physical assessments, learn to assess for signs of fluid volume overload, such as edema, elevated blood pressure, or deficits like dry mucous membranes or decreased skin turgor. For vital signs, understand the changes that may indicate fluid imbalances, for example, tachycardia or hypotension. For laboratory tests, be familiar with common tests to assess fluid and electrolyte status, including serum electrolyte panels, osmolality test, and urinalysis. For management and interventions, fluid replacement, grasp the importance of administering fluids appropriately, whether orally or intravenously. Understand the different types of IV fluids. Understand that there are crystalloids, which are solutions of electrolytes, for example, normal saline, and colloids, which are solutions that contain large molecules, example, albumin. Patient education. In terms of patient education, you want to teach your patients about dietary choices to maintain electrolyte balance and the importance of hydration. For the pathophysiology connection, understand the conditions. Recognize how diseases, example, heart failure or renal disease, can lead to fluid and electrolyte imbalances. In terms of nursing care principles, the nursing process, integrate fluid and electrolyte management into the nursing process. Assess, diagnose, plan, implement, and evaluate care. Evidence-based practice. Familiarize yourself with clinical guidelines and recommendations for the management of fluid and electrolyte imbalances. In conclusion, these points represent a foundational knowledge base of fluid and electrolyte essentials for nursing students. And you should consult your textbook or put in the comments an area that you'd like to go further in depth in. Being well prepared in these domains is vital for providing safe and effective patient care. Thank you for listening to my lesson on fluid and electrolytes. If you liked the presentation, please like and share. Comment what topics we should do next.